Simulated and experiential learning is about giving the students an authentic learning experience that's simulating the real world of work, if you like, through their engagement with various different types of technology and different ways of learning in the university. Gives them a safe space to learn so that they can practice being professionals without having the risk and the stress and anxiety of being out there in the world of work. So it's a really important complementary way of learning.
Here at Coach Lane campus, we've got a range of different types of experiential learning simulation equipment, ranging from virtual reality to augmented reality through to clinical environments with computerized patient mannequins. Simulation-based learning is absolutely essential within health professions education because what we tend to do is relatively rare but potentially catastrophic kind of case scenarios. You can't guarantee a student on placement in hospitals or in the community would come across these kind of experiences, but they're experiences that you do need to understand how to recognise and to manage appropriately.
The students love it. They might feel uncomfortable while they're going through it actually, but at the end of it, in terms of a learning experience, they all say it's fantastic. They really grow and develop as a student and it's very impactful for them. They tell us that it's one of the key ways that they learn in the programme.
We use current international standards for simulation activity. So it means that all of our simulation activity is underpinned by the latest evidence and best practices within simulation. So we create that safe learning environment that's realistic enough for students and qualified colleagues to actually participate and kind of repeat practice. Ultimately, the aim is about providing safe care for patients. We shouldn't be practicing on real patients, which should be all taught and then gradually build up those skills into the practitioner who's competent, confident and able to practice within the real world.
Northumbria University has invested really heavily in virtual reality. Being taught through the use of VR is taking stuff that would have previously been maybe a textbook or a written case study, and actually we can provide a really rich learning experience with the use of VR, and it's that immersive experience that a lot of our students take a great deal of value from. One of the big challenges in healthcare in this country at the moment is we know we have an ageing population, and with that comes increased frailty. So one of the ways we can use VR as a learning and teaching tool is by allowing learners to immerse themselves in those ideas of frailty that might include people living with dementia. Dementia can cause auditory hallucinations, visual hallucinations. You can read that in a textbook, but it's really hard to imagine the lived experience for those people. So we can use VR in that sort of way to allow people to really hone in on their empathetic skills and understand that lived reality for patients. To do that in a virtual space is really meaningful and really powerful for our learners as well.
This year we hosted our second robotic assisted surgery workshop for third year undergraduate operating department practitioners. This was to increase their knowledge and confidence within robotic assisted surgery theatres. There's been a huge increase in the number of robotic assisted surgeries being performed internationally. There's actually been over a 500% increase within the NHS and also private healthcare between 2016 and 2023, which just goes to show that there's a need to support the workforce. Why should we wait until students are graduates and they've become registrants? They should be underpinned in the undergraduate curriculum so they are like robotic ready. When we actually went into the robotic suite at the Newcastle Surgical Training Centre, the students got the opportunity to hands-on on the robotic equipment. It was amazing to see their confidence grow throughout the day because it's such a large piece of equipment and quite expensive. A lot of people are quite scared to touch this equipment. So to give this experience in a calm environment to learn at their own pace, it means that it's much more of a relaxed learning environment as opposed to the busy, demanding operating theatre. The robotic assisted surgery workshop was a huge success. It was well received by all students, very positive feedback. Undoubtedly, the workshop will continue to develop and expand over the years. It's benefit the students, the workforce and patient care.
In the occupational therapist team, we are using some virtual reality technique in order to support for the students' experiential learning. Say, for example, we had been using some VR scenario. At that point, we can apply some scenario-based example for the students to discuss, not only in the occupational therapy perspective, but also from the perspective from nursing, from social workers. I created a 360 video in order to let the student to be fully immerse themselves into that specific situations and environment. For example, some dementia patients have certain types of hoarding behavior. For the student, if they have relatively limited life experience, when they go to an older people's house with lots of hoarding, they may be quite scary, right? So at that point, we are having some sort of virtual reality stimulation in order to supporting the student, in order to prepare them better before they go to the real environment and real situations. Students enjoy this experiential learning very much.
Recently, we organised an interprofessional safeguarding simulation day, which involved members of staff and students from departments such as education, nursing, children's nursing, learning disability nursing and OT. And we come together to think about how we protect and safeguard the children and families that we serve. Students who took part in this conference benefit in a number of ways. Firstly, they get to work with other professionals that in reality they'll be working with once they are qualified. So it's that ability to understand other professions and how they work differently to maybe the profession that they're in themselves. So the scenario centres around a family who are experiencing domestic violence, and all the students come with a small piece of information from their discipline's perspective. So for example, education very much focus on children's outcomes and how they are in school. However, a nursing perspective might be something around the concerns about a recent visit to the GP. We are thinking how we work together and how teams can support in different ways to ensure that families have the best outcomes. The students absolutely love the experience. Obviously, before the conference, there's a little bit of anxiety about working with other professionals and other students that they potentially haven't met before. But we always collect responses from students after the event, and the way that they talk about how the event has developed their confidence is overwhelmingly positive.
We've had a really exciting week on campus this week with NHS Blood and Transplant. We've had 3 days of fully immersive sim for their specialist nurse trainees. And for this project, nurses come from right across the country, and we work collaboratively with NHS Blood and Transplant to look at that entire journey for a donor patient. So that started early on in the week with an intensive care setting. We've then moved into some simulation using actor-based simulation, having some really difficult and challenging conversations in that safe space of simulation. And then just today we've been in operating theatres and given them some challenging circumstances to deal with there in theatre as well. So a really fully immersive experience following the journey that a patient would take out in practice. What they're taking away is knowledge that they're going to go back to their respective hospitals, and they're going to implement that knowledge and enhance patient safety.
Northumbria are our academic partners with NHSBT, and we work together to deliver multidisciplinary training. Today we're on day 3 of a high fidelity simulation course. The day that we're doing today is the theatre element of the organ donation process. So we've been working really closely with our partners here at Northumbria to deliver this 3-day course. Now, organ donation can only happen in 1% of all deaths, so it's quite a unique and rare opportunity, but it is an opportunity that we have to manage really carefully and sensitively. So our colleagues at Northumbria help us to set up those safe environments where we can practice those communication skills for our nurses to be able to deliver information to grieving family members. Courses like we've been running today are really important from a safety point of view. We know that human factors are huge within the way we work, and also when things go wrong, sometimes we don't really reflect on how they go wrong. The idea of these courses is to have heightened awareness in the preparation for the process to run well, good communication to make sure that things don't go wrong, but when they do, that people know how to react to them from a safety perspective. We love working with the Northumbria University team. We've got brilliant relationships, great communication, and we find them all really personable. What's really important is, of course, they have a massive academic background, which from a clinical practice point of view is really tricky to keep up sometimes in that theoretical component. So we do bounce ideas off each other. They tell us around the latest innovations, certainly in reflective practice, debriefing, feedback, and that's really important to us from a clinical practice point of view. So it's really, really important, the relationship that we have.
Some of the key skills from simulated into professional education are around the clinical application of their skills, but also relative to the other professions' roles and responsibilities and what they're doing. Understanding where the roles and responsibilities are different, but also where there is overlap and where those boundaries either need to be maintained or where they need to work together. Learning together in an environment that's perhaps outside of practice is really valuable, just to create that space and that time where they can really understand and there's not a real life patient or service user who's needing care or treatment. It's about practice, it's about repetition as well. We get them to repeat these skills, which is key to learning, because that really embeds that learning. It really helps them to assimilate and to understand the key skills that we want them to take into practice. After a simulated learning session, we get together and we do a 20-minute debrief. I think debrief is a really important way to help them to reflect. It's all about reflection. It's about reflecting on what they did well, on what they might have done differently. We talk about some of the technical, some of the clinical aspects, so there's a lot of learning from that perspective. The debrief is where the learning happens. That's where the magic happens.
My next placement is actually in theatres, so it's given us that little bit of insight to what to expect when I go there. I'm looking forward to taking what I've learned today, going into theatres on my next placement.
I think experience in sim allows students to make mistakes in a controlled environment, and then the outcomes for patients are going to be better. So sim learning allows a safe space, and then it means when you go into the real world, you can give patients safer and better care. I think sim and the faculty at Northumbria University will make me be a better nurse.
Simulation is a valuable experience for students. It helps them develop their skills, their knowledge and their confidence. But more importantly, it helps bridge the gap between theory and practice and allows the students to develop as safe and effective practitioners.
Absolutely essential in an integrated health and social care system that professionals are trained to work together better. You can see from various events that have happened over the years what happens when those systems fail. So it's really important that those students engage in that interprofessional learning so that they can collaborate, communicate and work together with confidence to keep people safe.